so I don't miss anything. First, I'm a chiropractor. I've been a chiropractor for 8 years, and I own CrossFit Still Creek and Premier Health and Rehab Solutions. It's about 15,000 square feet over in Southwest Charlotte by Airsley, 45 at South Tryon. The doctor's office is chiropractic and rehab, and we'll do some nutrition. We have a nutritionist in there that works as well. And then CrossFit is small group trainings, like Julie said. She runs some classes over there. Kettlebells, barbells, upper plates. So when you drop weight on, like at your gym, it balances, nobody yells at you. Ropes to climb, sleds to push. Old athlete to a 70-year-old guy after back surgery or something like that. A lot of the stuff that we do in there is rehab. We try to transition our patients to training after surgeries, or just people that have some type of pain or dysfunction into the doctor, from the doctor's office into CrossFit, or vice versa. A lot of people come to CrossFit and want to get into shape, and they've got all sorts of problems. They can't even bend down without hurting themselves, or squat without hurting themselves. So we work with them to get them into shape, to actually get into shape. It's for everybody. If you might hear people say that they need to get into shape to do it. You come and watch a class. We'll invite you. You'll see a lady that's never seen a gym before, and everybody that comes into our place is an athlete. So when I talk about tonight, when an athlete comes in, you may have never been an athlete before, but the second you're in our facility, you're an athlete now, and we'll treat you as such. So what we'll go over today is just trigger points and just some quality of tissue that we deal with a lot. First, we don't use this stuff as a replacement for maybe massage or seeing a doctor or coming to our office, but we try to teach them, we teach our athletes and our patients this to kind of bridge the gaps between treatment. It's expensive to get a massage every week. It's expensive to see the chiropractor 3 or 4 times a week. So we give this, so we teach people how to do these things to bridge the gaps between the treatment. A trigger point, in the simplest terms for people to understand, is just a knot, okay, in your muscles. Really just an area of the muscles that, well, understand that in order for you to live, your muscles have to expand and contract, right? My heart needs to expand and contract, my muscles need to expand and contract for me to walk and move. So there's areas in these muscles, because of some type of physical or chemical stress or emotional stress, that there's an area in the muscle that does not contract and relax anymore, and that can lead to all different types of dysfunction and pain or referred pain. So our job, what we teach people, is how to get rid of these problems. A lot of times people will say, oh, my hamstrings are always tight, or here's always tight, or my back, and I stretch and it feels good for a little while, and then it comes back. And then I stretch, and I went to the doctor, and I stretch, and I stretch, and I stretch, and I stretch, and it always feels tight. Somebody a long time ago taught me this, just to give you an idea of what happens. Imagine that my muscles are made up of hundreds of these ropes. Let's say my hamstring, okay? Hundreds of these in my hamstring, and maybe 10 of them have a knot like this. So this would be a trigger point, right? So that rope just got a little bit shorter, okay? Now, you're going to be showing people this when you go back to work, so pay attention, okay? So this got a little bit shorter, right? You're going to go and you're going to stretch, and somebody's going to tell you to stretch, and you're going to stretch, and now you're going to feel a little bit better because this just got a little bit longer, right? So maybe a day or two goes by, you go back and you work your 80 hours a week sitting at a desk and driving, talking on the phone, and then it gets tight again. And you're going to go back in and you're going to say, man, my back, my neck, my shoulders, my tricep pivot is tight. And you're going to stretch, 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 and this knot's still there. It doesn't go anywhere. It gets tighter and tighter and tighter, and that's where a trigger point is, okay? The second this thing gets tied, that's what a trigger point is, and you want to remove this knot, not just keep stretching and stretching and stretching and stretching it, okay? People come in all the time. I've been everywhere. I've tried everything, and my muscles are so tight. Kinesiotaping might work. I don't deal with it often, but obviously people do it all the time, and it works. But other types of massage and things like that to get rid of these trigger points is what we need to teach people how to do. So when you go back doing the same thing over and over again, stretching and sitting at your desk, which is like the American way, right? These are problems that don't get better can lead to headaches, muscle weaknesses, referred pain, and then eventually, when muscle doesn't control